Have you ever heard about fibromyalgia and chronic fatigue syndrome? Fibromyalgia is a disorder characterized by widespread musculoskeletal pain and fatigue, while chronic fatigue syndrome is extreme fatigue unexplained by any underlying condition. Although they may seem similar, they are indeed different in several ways. Now let's delve a bit deeper into fibromyalgia. This condition is often characterized by chronic muscle pain, fatigue, and sleep problems. Additionally, people with fibromyalgia may experience painful tender points or trigger points throughout their bodies. It's not uncommon for fibromyalgia to go hand in hand with other conditions such as tension headaches, irritable bowel syndrome, anxiety, and depression. Each person's experience with fibromyalgia is unique, adding another layer of complexity to this condition. Fibromyalgia can be quite debilitating, but what about chronic fatigue syndrome? Chronic fatigue syndrome, on the other hand, has its own characteristics. It's characterized by profound fatigue, a hazy memory or lack of concentration, unrefreshing sleep, and an overwhelming exhaustion that lingers for more than 24 hours following physical or mental exertion. It's a tricky condition, often overlapping with fibromyalgia, causing confusion in diagnosis. But these conditions, while similar, are not identical. They each have their own unique symptom profiles. While they share some symptoms, there are clear differences between the two. So, how exactly do fibromyalgia and chronic fatigue syndrome differ? Well, both conditions involve fatigue, but it manifests differently in each. In fibromyalgia, fatigue is often coupled with discomfort or pain, while in chronic fatigue syndrome, fatigue is the primary symptom. Another key difference is that fibromyalgia has identifiable trigger points, spots that are particularly sensitive to pressure, whereas chronic fatigue syndrome doesn't have these specific triggers. Despite these differences, both conditions can significantly impact quality of life. In conclusion, fibromyalgia and chronic fatigue syndrome are two distinct conditions. Each has unique characteristics, yet they share some similarities. The key differences lie in their symptoms and their management. Remember, if you or a loved one are experiencing any of these symptoms, it's important to consult with a healthcare provider. Understanding these conditions is the first step to managing them.